My name is Isidro Figueroa. I'm the city's principal planner, and I will be presenting the Firearms Ordinance Update, adding medical clinics and hospitals as a sensitive use requiring a 600-foot separation from businesses engaged in the sale of firearms and ammunition and firearm ranges. The Zone Text Amendment to the Oxnard City Code, specifically Chapter 16, is to add medical clinics and hospitals as a sensitive use requiring separation from firearm ranges and businesses engaged in the sale of firearms and ammunition. The proposed regulations would apply citywide and pertain to the general commercial and limited manufacturing zoning districts. Providing some background, on July 16, 2019, during a public hearing, the Council approved a zone text amendment to amend chapters 11 and 16 of the Oxnard City Code to establish definitions for ammunition, firearm range, firearm, and firearm and ammunition sales, to establish and or modify land uses related to these activities within the general commercial, limited manufacturing, and community reserve zoning districts, and to establish siting criteria, operational considerations, and the process for review of special use permit applications related to these uses. During the public hearing, the council also deliberated on the possibility of including hospitals and clinics as a sensitive use. Public testimony urged the council to consider clinics and hospitals as sensitive uses. Public testimony also urged the council to consider a patient's safety and security, which should be protected equally as the sensitive uses being considered under the proposed ordinance. Firearm and ammunition sales and firearm ranges require a minimum 600-foot separation from any sensitive use. The council directed staff to research the potential inclusion of medical clinics and hospitals in the ordinance and report back at a future date. On April 13th, 2021, the Community Services, Public Safety, Housing, and Development Committee unanimously voted to direct staff to pursue a zone text amendment to amend Chapter 16 of the Oxnard City Code to include medical clinics and hospitals as a sensitive use. Staff was not given direction to amend any of the standards and requirements currently in place that regulate firearm ammunition sales and firearm range uses. Nor was direction given to alter the regulations or the operations of any of the four existing firearm and ammunition retailers within the city. On May 17th, 2021, a community workshop was held for the zone text amendment, and two members of the public attended and made the following comments. One member inquired about an existing legal nonconforming firearm retailer, which is Big Five, located near the Orchard neighborhood. The other comment was made by Mr. Keith Lauterbach, which also submitted a letter addressed to the City Council outlining his opposition to the proposed zone text amendment. On July 15, 2021, the Planning Commission reviewed the proposed zone text amendment. Two individuals provided written correspondence supporting the zone text amendment. Mr. Keith Lauterbach provided comments on a proposed firearms use that would not be allowed if medical clinics are included as a sensitive use. Mr. Keith Lauterbach submitted a letter of opposition to the proposed zone text amendment. The Planning Commission discussed two amendments to the proposed zone text amendment. One, consider reducing the required 600-foot separation between firearm uses and a sensitive use to 400 feet for medical clinics only. The other, consider decreasing the required 600-foot separation between firearm uses and sensitive uses to 500 feet. Both motions failed. The Planning Commission voted unanimously to adopt Resolution number 2021-15, recommending that the City Council adopt the proposed zone text amendment as presented. Staff has contacted the four existing legal nonconforming firearm retailers. One firearm retailer also operates a firearm range via U.S. Postal Service and phone of the proposed zone text amendment and notified them of all the public meetings to date. The existing firearm retailers have declined to participate in the public meetings so far. The Oxnard City Code does not contain definitions for medical clinics and hospitals. Using best practices, staff outlined the following definitions to guide discussion. Medical clinic means an organized outpatient health facility that provides direct medical, surgical, dental, optometric, or podiatric advice, services, or treatment to patients who remain less than 24 hours, and they may also provide diagnostic or therapeutic services to patients. Hospital means a health facility having a duly constituted governing body with overall administrative and professional responsibility and having an organized medical staff which provides 24-hour inpatient care, including one or more of the following basic services: medical, nursing, surgical, anesthesia, laboratory, radiology, pharmacy, dietary services, or psychiatric care and treatment. The medical clinic definition is not intended to include land uses such as, but not limited to, medical insurance and medical services, retail medical equipment and supplies, pharmacies, unless ancillary to a medical clinic or hospital, medical research and laboratories, unless ancillary to a medical clinic or hospital, medical devices, equipment, and hospital supplies, manufacturers, ambulance services, veterinarian services, spa and wellness centers. Firearms related businesses must maintain a 600-foot separation from sensitive uses, which are non-residential daycare, child or adult, parks, churches, public or private schools, any residentially zoned property, the Oxnard Transportation Center, and the Oxnard Airport. A 200-foot separation is required between individual firearm-related uses. Based on the proposed definitions for medical clinics and hospitals, staff plotted clinics and hospitals on the previously approved buffer map under Ordinance 2961, which is indicated on the screen. Over 290 medical establishments were plotted based on the city's business license rolls. The map before you identifies the zoning areas, red and orange, throughout the city that allow firearm sale uses under the current firearms ordinance. The green dash areas identify all of the areas where firearm sales uses are allowed if hospitals, clinics are included as a sensitive use. The map before you, map 2, contains a map that identifies all sensitive use buffers, including medical clinics and hospitals. The existing city baseline indicates that approximately 1.57% of the land area where firearm sales uses are allowed to operate currently in the city. Potentially, if medical clinics and hospitals are included as a sensitive use, the available land area where firearm sales uses are allowed would be reduced by 0.38% to approximately 1.19%. Community Development Department staff have consulted with the City Attorney's Office and Police Department and determined inclusion of medical clinics and hospitals as a sensitive use would provide for a legally sufficient number of parcels to accommodate firearm uses. The zone text amendment is exempt pursuant to sections 15060C2 and 3 and 15061B3 of the California Environmental Quality Act. Regulatory actions which will not result in direct or reasonably foreseeable indirect physical change in the environment, and when it can be seen with certainty that there is no possibility that the activity in question may have a significant effect on the environment, are not subject to CEQA. Staff's recommendation is that the City Council, 1, conduct a public hearing, 2, determine the zone text amendment is exempt from the California Environmental Quality Act pursuant to CEQA guideline sections 15060C2 and 3 and 15061B3, and introduce an ordinance for first reading by title only, waiving further reading, adding medical clinics and hospitals as sensitive uses, requiring separation from establishing regulations to address firearm ranges and the sales of firearms and ammunition. This concludes staff's presentation. Staff is available for any questions. Thank you.